Mike Levin is a pediatrician and allergist. He runs a large clinical service at the Red Cross Children's Hospital in Cape Town and is responsible for general pediatric and pediatric allergy education of medical students, junior doctors, and fellows in training. He is the head of pediatric allergy training of the University of Cape Town's accredited subspecialization program in allergology. Is that how one says that?
Yep.
Thank you so much for your time, Prof. Mike. My audience either lives with eczema themselves or they parent children with eczema. So they know about the red patches and the dryness and the itch. Yep. But as a starting point, for those who might not have ever delved into what really causes it, what is eczema really?
So, that's a really important question because what we're understanding now about eczema is that the major problem with eczema is that people's skin cells are not really stuck together as tightly as they're supposed to be. So because the skin cells are not tightly together, they're a little bit leaky, and water can get out of the skin easily, and irritants and allergens can get into the skin easily. And what this then does is it sets up a secondary process of inflammation that leads to the redness and the swelling and the itching and all of the visible signs and symptoms of eczema. But the underlying problem, the leaky skin, can't really be seen properly by the people, and that's why it's very recognized and undertreated. And this is really important kind of implications for the management of people with eczema, because you have to take proper care of that skin barrier dysfunction as really the foundation and the basis of every other management that there is for eczema.
Leaky skin. Is there? I've got a keen interest. I'm not medically trained, but I've got an interest in the recent research into the microbiome. If I may ask, do you know of links that they've made with eczema and problems with the microbiome?
So yeah, there are definitely a lot of various different factors that contribute to the barrier dysfunction. And there's that physical barrier, which is the actual skin cells sticking together. There's the chemical barriers, so that's the lipids and the other antimicrobial substances that are secreted on top of the skin that come from the skin itself, and that need to be preserved as much as possible by not messing up that barrier. There's the immunological barrier, which is the final barrier right at the end, kind of deeper in the tissues. And then right on the top, there's that microbial barrier. So that's the good commensal organisms that are helping stimulate a normal immune system and are killing off or competing with the pathogenic bacteria that are going to cause infection and are going to cause more damage to that skin barrier function directly. But I think that all of these other barriers can really be seen as the things that help the physical barrier. The physical barrier is the most important barrier that we have. And that's why, like I was saying, taking care of the physical barrier is really important. And the ways that we can do that is by putting loads of emollients on the skin to kind of just seal it off physically. You're creating another physical barrier on top. So it's like having a brick wall that is a bit leaky and then you plaster it. So you stick a layer of plaster on top. You don't actually fix the brick wall. You don't actually push extra moisture in. So that's why we don't call these things moisturizers. We call them emollients, because they're not designed to actually replace the moisture in, dry skin. They're an extra barrier on top. And again, there are implications of that. The implication of that is that if they're not there on the skin, then they're not doing their job. And that's why, unlike like a moisturizer, if you've got normal skin that you can use once a day and then everything is fine, an emollient needs to be put on very, very frequently throughout the day, because it only really lasts for while it's there. whether that's 4 hours or 6 hours. Even if it's a really long-lasting emollient lasting 6 hours, you'd still have to put it on 4 times a day to be covered for that 24-hour period. So that's the one aspect, is replacement of the additional barrier. And then the other thing is to avoiding things that mess up the barrier. So that's harsh soaps or chemicals or detergents in your clothes, or, all of the things that we say, you've got to find an allergy-friendly product that doesn't have any of these things in it. Those are designed to stop those nasties from messing up that skin barrier, which, like I said, is the fundamental underlying cause of all the subsequent features that lead to the eczema.
Mm-hmm. And you, if I'm not mistaken, helped founded the Allergy Foundation of South Africa. Am I correct?
Yes, absolutely. We founded the Allergy Foundation of South Africa, and the Allergy Foundation of South Africa runs this website that I'd really encourage people with eczema to look at, because there's a huge amount of information on there that can help you understand and manage your condition better. We also have developed some products ourselves to help people with atopic dermatitis. So the most important of those is called Kiddie Calmwear. It's a replacement for the wet wrap therapies that are currently very cumbersome because people have to use bandages. So we developed a range of clothing that can be used for kids to help you protect and heal your skin. And then importantly, we run the Allergy Foundation Seal of Approval program, whereby we give certification really to products that we know that are either beneficial for in this case, the skin of people with atopic dermatitis, or who lack those harmful substances that other products might have in them that could otherwise be causing damage to the skin of people with AD. So it really is important that if you've got eczema, that you are aware of those seal of approval products, whether you're looking at emollients or detergents, for example, or cleaning agents, that you choose something that you know is going to either be beneficial for your skin or doesn't have those ingredients in that can harm your skin. And then the final thing I want to mention about the Allergy Foundation of South Africa is we have a very active atopic dermatitis support group, which is run in conjunction with patients and helps people through running lots of webinars where we have online Facebook discussion events with experts in allergy, as well as dermatology, psychologists, patients, etc. And further information from that can also be found on the AFSA website, which is really obvious, easy to remember, www.allergyfoundation.co.za.
Great. I'll also put the links underneath the video for anyone to the support group and the website. Prof Mike, just one product that many parents are surprised to learn about that can be part of these triggers for eczema has been laundry detergent. What's the story with laundry detergent?
So laundry detergent is one of the things that can cause breakdown of that physical skin barrier and disruption of the chemical barrier on top of the skin. So it's really important when you're choosing a laundry detergent to make sure that it doesn't have any of these special enzymes in it that break down proteins. Because although those are very effective in kind of thoroughly and extra thoroughly, unnecessarily thoroughly cleaning your clothes, the proteases, the enzymes that are left behind on the clothes, will actually physically attack your skin as well and break them down. So that's one of the things that really needs to be avoided. The other thing is to make sure that when you have a detergent, that the pH of the detergent is okay, that it's not going to be having any of the other chemicals that are irritant to the skin that might be left behind.
What is the okay pH, if I may ask? What pH must we look at?
We're really looking for something that goes on the skin of a pH that is slightly acidic or around the normal pH of the skin. So that's really the basics for leave-on products. Products that are kind of washed off or are in detergents it's slightly less important, but it is important that those chemicals are not in there. So, that's the major factor about detergents. And the Seal of Approval program will have its own specific standards, which we've got written down and we don't really share with people, that specify those criteria that have to be satisfied. And those criteria obviously differ for different types of products, whether it's a detergent or whether it's a makeup or whether it's a sunscreen or whether it's a soap or whether it's emollient. They're all different because they have slightly different criteria that need to be adhered to.
Is it because it's on your skin for different amounts of time?
Absolutely, that's one of the factors. But I wanted to come back to the washing issue and the detergent issue. Apart from the selection of the type of detergent that you use, it's also really important that people avoid fabric softeners because they don't really have any major beneficial effect. That they often are recommended that they put an extra rinse cycle on the washing to make sure that it is as thoroughly all of residual chemicals, etc., are taken off, and that the fabrics that you choose for your clothing are specifically chosen to be soft and non-irritant. And that doesn't necessarily mean that everything must be made out of cotton and nothing must be made out of wool, because it's the texture that's important rather than the constitution of that. And some of the wool fabrics are beautifully soft and non-irritant. Dyes that can leach out of the fabrics onto the skin are obviously going to be causing a problem. And then, zips or seams that are on the inside should really be protected from contact with the skin of people with AD to prevent physical irritation and scratching.
So we've been speaking about the products you use and the clothes you wear. Is there anything one can do regarding diet?
So diet is actually not particularly important with atopic dermatitis in the vast majority of patients. And this is one of the most important misconceptions that we need to kind of correct about the condition. Like I've said, the underlying problem in AD is the skin defect itself, the skin not sticking together properly. And so really the majority of our energy and effort needs to be in preserving that skin barrier and then healing that skin barrier. What is true, is that a consequence of that abnormal skin barrier I mentioned is the water getting out and then the allergens and the irritants penetrating and getting in. And one of the things that can be a secondary consequence of eczema is that if food allergies penetrate the skin, which is obviously not the way they're supposed to contact with the immune system, you can then develop antibodies against that food. And on top of that, you can develop dysregulation or lack of control of those antibodies, which might then go on to lead to food allergy. Now, it's really important that people understand that those are two completely separate processes, because almost everyone with eczema will have some degree of raised antibodies to foods, but they are still kept under control and they are regulated by your immune system, and you have absolutely no response to those foods when you eat them. And that is why people who are not well aware of eczema, even many doctors and specialists, are incorrectly testing people with eczema for the sensitization to those foods. That's the presence of those antibodies, and then incorrectly assuming that that means that the person is dysregulated against those foods and calling them allergic when they're not.
Okay.
And this is creating a massive problem with inappropriate avoidance of foods for people with eczema for no apparent reason at all.
So it's not really that the food causes the eczema, but the eczema causes
sensitization. Exactly.
Okay.
That's exactly the problem, is that the eczema causes sensitization. And then people say, well, because my skin is messed up, it must be the sensitization that's causing the problem. And then they don't pay enough attention to the skin barrier. And then it's no surprise that nothing gets better, because avoiding those foods or changing their diet is going to have absolutely no effect whatsoever on their eczema itself. When the food antibodies are no longer regulated by your other aspects of your immune system and they kind of go wild, that's when you develop what we call normal IgE-mediated food allergy. And that's why people with eczema can have hives or urticaria or even anaphylaxis when they eat a specific food. So it's not that that food is making the eczema worse. It's that the eczema is a risk factor for them getting the other type of food allergy that causes anaphylaxis. So if somebody with eczema is having a problem that every single time they, for example, eat eggs and they get itching and swelling that comes on immediately after eating that food, that person needs to urgently get medical care from somebody who knows about allergy and deal with their food allergy, not their eczema, because the eczema is just the risk factor for causing that food allergy. The people who've got concerns that the food is causing a problem with the eczema, but it's not the same food all the time. Sometimes it's one food, sometimes it's another. And, they're not really sure, but they just think foods are causing a problem. In those people, I can 100% guarantee you, number one, they do not have IgE-mediated food allergy that is going to be severe enough to actually cause them to have a problem that is life-threatening. And number two, it will be more beneficial and important for them to continue eating those foods, treat the skin much better with your emollients and your protection and your steroids in order to make sure that you retain what degree of tolerance you have to that food so that you never develop an IgE-mediated food allergy. So stopping foods in the presence of eczema is actually bad for your health, not good for your skin.
Oh, that's very interesting. So if I try to understand, you've got a leaky skin, that is, you're born with that, and you can hardly ever fix that. Do I understand that correctly?
You can't fix it permanently, no.
Okay. So, but then you try and keep a barrier on by using emollient. You try to avoid things that will make the problem worse. What happens now if there is a flare up, Prof Mike? What must moms do then, and when is it serious?
So that's a great question, because there are a lot of misconceptions about that issue as well. So let's just again go back to kind of a little bit of the basics so that people can really understand what's going on. When that skin barrier is messed up and you have your penetration of your irritants and your allergens in your skin, you get a process of inflammation. And that inflammation then causes the rash, which is the redness and itchiness, which then, when it becomes chronic, causes that darker discoloration of the skin and the thickness of the skin. So all of those things indicate that there is inflammation in the skin, and that the inflammation is itself directly leading to skin damage. So the quicker you fix that inflammation, the less damage that inflammation is going to be able to cause the skin. So in that situation, steroid ointments, which suppress inflammation very, very thoroughly, are your absolute best friend. And that's why we say, actually use the strongest strength steroid that is necessary to effectively treat that inflammation, and then get it under control quickly to prevent that skin damage. And then once it's under control, slowly reduce the strength of the steroid until you either don't need any steroid at all, and you can just go back to using your emollient, or you leave yourself with a level of steroids that can't possibly cause itself any problems to the skin. So that's a mild to moderate steroid used once or twice a week. That is what we call proactive therapy or preventative therapy. We know that using that amount of steroids does not cause any damage to the skin, despite what your grandmother and your aunt and the pages on the interwebs are telling you. It's not going to cause any problems to your skin. And in fact, what you've successfully done is you've healed that inflammation with the strong steroids to prevent the damage. So don't be afraid of steroids. Don't be afraid of using them when your skin is bad, but wean them down to the lowest possible strength into something that is not going to be harmful after you've got that skin under control. And then the proactive therapy options, we've got mild to moderate strength steroids. We've also got ointments that are tacrolimus and pimecrolimus, which are non-steroid treatments for the skin. And we've got a new kid on the block called crisaborole, which is also a non-steroid treatment on the skin. So these ointments are slightly less effective than steroids. So they're not great at curing that flare when it's really, really bad, but they're really nice to use as long-term options on the skin because they're completely free of any of the side effects of steroids that could be had if you use the inappropriately strong ones for longer durations of time.
Wonderful. Thank you so much. That's a mouthful and a lot of information to help in every situation.
Yeah, it's a lot of information, and that's why we want people to go onto the website, because we've got pamphlets on all of these different aspects of AD. They're broken down into more bite-sized pieces, and people can come back and read them and look at them whenever they want. So we do know that too much information can lead to information overload. So coming back and getting it from the website is probably a better way of accessing or at least reviewing some of the information that you've heard about today.
And then that support group, hey, because there you meet people who are actually in it and who's also busy finding their way.
Absolutely.
Thank you so much for your time, Prof Mike, and all the best with your work.
No problem. Have a great day.